9 o'clock. Let's get started here. I'd like to call the meeting to order and welcome everyone in attendance. The committee has under construction the estimates of the Ministry of Health for the fiscal year ending March 31st, 2025. I'd ask that we go around the table and have members introduce themselves for the record. When we come to you, Minister, if you would kindly introduce the people with you at the table, that would be great. Let's start to my right.
Sure. Good morning, everyone. Brandon Lunty, MLA for Leduc Beaumont.
Chelsea Petrovic, MLA for Livingston McLeod.
Martin Long, the MLA for West Yellowhead.
Good morning, everyone. Peter Singh, MLA Calgary East.
Good morning, MLA Jennifer Johnson, Lacombe Panoka. To my right, Becky Rees, my assistant.
Adriana LaGrange, MLA for Red Deer North, Minister of Health. I also have with me Andre Tremblay, my Deputy Minister, Darren Headley, my Associate Deputy Minister, Christine Sewell, the Assistant Deputy Minister of Finance and Capital Planning, and Katie Fuchs, Director of Executive Operations.
Good morning, I'm Luann Metz. I'm the MLA for Calgary Varsity, and I'm the opposition health critic.
Good morning, Lori Sigurdsson, MLA for Edmonton Riverview.
Janet Aramenko, MLA for Calgary Curry.
Hi, Joe Cece, MLA for Calgary Buffalo.
And good morning, everyone. I'm Jackie Lovely, MLA for the Camrose constituency and chair of the committee. And do we have any members participating remotely? No, we don't? Okay. So I'd like to note the following substitutions for the record. Honorable Mr. Cece is substituting as Deputy Chair for Ms. Goring. A few housekeeping items before we turn to the business at hand. Please note that the microphones are operated by Hansard staff. Committee proceedings are live streamed on the internet and broadcast on Alberta Assembly TV. The audio and visual stream and transcripts of meetings can be accessed via the Legislative Assembly website. Members participating remotely, if they dial in, are encouraged to turn on their camera while speaking and mute when not speaking. And please set your cell phones on silent and your other devices as well for the remainder of the meeting. Honorable members, the main estimates for the Ministry of Health should be considered for 6 hours. Standing Order 59.09 sets out the process for consideration of the main estimates in legislative policy committees. Suborder 59.016 sets out the speaking rotation for this meeting. The speaking rotation chart is available on the committee's internal website, and hard copies have been provided to the ministry officials at the table. For each segment of the meeting, blocks of speaking time will be combined, but only if the minister and the member agree. If debate is exhausted prior to 6 hours, the ministry's estimates are deemed to have been considered for the time allotted in the main estimate schedule, and the committee will adjourn. Should members have any questions regarding the speaking times or rotation, please email or message the committee clerk about the process. With the concurrence of the committee, I will call a 5-minute break during the midpoint of the meeting. However, the 3-hour clock will continue to run. Does anybody oppose having a break today? Okay, we'll have a break. And I see that Member Bochenko.
Good morning, everyone. I apologize. I had a broken bus in the way.
There's no room for excuses. Just introduce yourself, member.
With that, my name is Andrew Bochenko, MLA for Drayton Valley, Devon. Thank you and good morning.
Ministry officials who are present may, at the direction of the minister, address the committee. Ministry officials seated in the gallery, if called upon, have access to a microphone in the gallery area and are asked to please introduce themselves for the record prior to commenting. Pages are available to deliver notes or other material between the gallery and the table. Attendees in the gallery may not approach the table. Space permitting, opposition caucus staff may sit at the table to assist their members. However, members have priority to sit at the table at all times. Points of order will be dealt with as they arise, and individual speaking times will be paused. However, the block of speaking time and the overall 3-hour meeting clock will continue to run. Any written material provided in response to questions raised during the main estimates should be tabled by the minister in the assembly for the benefit of all members. Finally, the committee shall have the opportunity to hear both the questions and the answers without interruption during the estimates debate. Debate flows through the chair at all times, please, including instances when speaking time is shared between a member and the minister. I would now invite the Minister of Health to begin with your opening remarks. You have 10 minutes, Minister.
Thank you so much, and good morning. I'm pleased to present the health estimates for the 24-25 year. Before I guess I don't have to introduce my officials, as I already did. So I'd like to welcome the other members of the Alberta Health Executive Team who are here in the gallery. Thank you all for being here. I've got an A team, and I just want everybody to know that. Budget 2024 provides yet another record investment in Alberta's healthcare system. It recognizes that the current healthcare system is fragmented and needs refocusing to improve patient outcomes, support frontline workers, and ensure every Albertan has access to services when and where they need them. It delivers on our commitment to maintain capacity and advance goals outlined in the Healthcare Action Plan, like reducing wait times, improving emergency medical services, and hiring and training more staff. And it supports capital projects across the province that will improve the delivery of healthcare while ensuring Albertans can receive value for dollars spent. In total, Budget 2024 provides $26.2 billion in operating expenses for Alberta Health, an increase of 4.4% from the 23-24 forecast. This is the highest ever healthcare budget in our province's history. With this level of funding, we are continuing to prioritize the delivery of high-quality, reliable health services across the province while recognizing that there is more to be done. Our ongoing efforts to refocus the healthcare system will ensure that we build a better system that supports patients and healthcare workers while providing oversight and using metrics to indicate progress and success. It will take time, and the conversations we are having with patients, families, caregivers, and healthcare workers across the province have provided valuable insight that will lead to change. I'd like to spend a few moments talking about Alberta Health Services. Through Budget 2024, the total expense budget for AHS is increasing by 3.6% to $19.1 billion. These funds will provide healthcare workers with support and resources to deliver across the province. It is important to recognize that we are seeing increased demand for services, and we are relying on AHS to find efficiencies to meet the needs of Albertans. Through our refocusing efforts, we will be transitioning AHS to focus on acute care. However, that transition will take time. Come fall, the new acute care organization will be operational with dedicated leadership that will be held accountable and tasked with achieving priority goals to improve patient outcomes. Moving to primary care, the budget also includes $475 million in 24-25 to support funding for primary care networks and nurse practitioner operations, and the continued implementation of the Modernizing Alberta's Primary Healthcare System Initiative, or MAPS. We are also providing $6.6 billion this year for physician compensation and development on top of the $200 million stabilization funding that was previously announced in December of 2023. Budget 2024 also provides $126 million over 3 years for the Rural Physician Expansion Program, which provides rural, Indigenous, and other learners with increased access to medical education. Last year, Alberta welcomed 331 physicians, an increase of 2.9%, and more than 7,500 regulated nurses, which is an increase of 11%. Specific to emergency medical services, we are continuing to make investments that strengthen the system and support patient care. Budget 2024 provides $730 million for EMS in 24-25. We're also providing an additional $25 million towards a total investment of $35 million over 3 years to procure new EMS vehicles and upgrade equipment, which we expect will help improve response times. We're also taking steps to reduce wait times for surgeries. Our goals are to ensure surgeries are taking place within recommended clinically acceptable wait times and to provide access to surgeries in more communities. Budget 2024 provides $313 million over 3 years for the Alberta Surgical Initiative Capital Program to add and expand operating rooms and boost surgery capacities in hospitals. AHS will also spend $305 million over 3 years to complete more surgeries across the province. As I mentioned earlier, we recognize the current system is not working effectively. However, it is critical that we maintain capacity as our refocusing work continues. Budget 2024 invests $236 million in 24-25 to deliver on the goals of the Healthcare Action Plan. These funds will support capacity and flow initiatives to decrease emergency room wait times, improve EMS response times, and reduce wait times for surgeries and empower healthcare workers. Our government understands that every Albertan, regardless of their age or circumstance, deserves quality health care. That's why we are reshaping our continuing care system to better support families and caregivers, healthcare providers, and operators. This year's continuing care budget is $1.6 billion, an increase of 6% from the 23-24 forecast. Last year, we announced an investment of $1 billion over 3 years to transform the continuing care system. As part of this commitment, $377.7 million is being provided this year to ensure more people can receive the care they need in their homes and communities. We will also receive $139.4 million this year through the Aging with Dignity bilateral agreement to scale and spread continuing care transformation investments. We're also taking steps to support our youngest Albertans and their parents. Through Budget 2024, we're supporting prenatal and postnatal health by investing $10 million to develop and implement a province-wide midwifery strategy and $8 million to expand the Alberta Newborn Screening Program. Recognizing the need to invest in women-focused research, advocacy, and care, we're also providing $10 million each to the Alberta Women's Health Foundation Legacy Grant and the Calgary Health Foundation. On top of these investments, we are continuing to support capital projects across the province. Budget 2024 includes $4.5 billion over 3 years to address health capital needs. This includes $3.2 billion for infrastructure and equipment, $512 million for the maintenance and renewal of existing facilities, and $84.8 million for the information technology projects, and $747 million for AHS self-financed projects. Some highlights include $25.2 million for the Beaver Lodge Health Centre replacement, $108.5 million for the Arthur J.E. Child Comprehensive Cancer Care Centre, $20 million for a standalone Stollery Children's Hospital, $810.2 million for the Red Deer Regional Hospital Centre redevelopment project, $71.9 million for the Lacrete Maternity and Community Health Centre project, and $65 million for the Rural Health Facilities Revitalization Program. To conclude, Budget 2024 builds on many of the focus areas our government has outlined over the past year. It recognizes the need to create a more effective healthcare system while ensuring we maintain healthcare capacity so Albertans can access the services and care they need today and well into the future. Thank you, and I'm pleased to take your questions.
Thank you so much, Minister. We'll now begin the question and answer portion of the meeting. For the first 60 minutes, members of the official opposition and the Minister may speak. Honourable members, you will be able to see the timer for the speaking block both in the committee room and on Microsoft Teams. So members, would you like to combine your time with the Minister?
I prefer block time.
Block time and Minister?
The block time, which is 10 and 10, I believe.
Yes.
Yes.
That's fantastic. All right. So the block time is 20 minutes, during which time you may go back and forth with questions if you change your mind, but we're going with block time. Member, you have up to 10 minutes. Please proceed.
Thank you very much. So I appreciate the opportunity to be able to speak today and ask questions. I'm going to minimize preamble because there's a lot of questions to get through. And I'm fine if there are things that you want to provide in writing afterwards, just that would suit me just fine. So the first thing I'm going to go through is the business plan for the Health Ministry and related estimate items as I can connect them. Sometimes it's a little bit challenging. The key objective of Outcome 1 is the enhanced timely access to a number of important things, and key objective 1 really focuses on EMS, surgical wait times, emergency department wait times, lab and diagnostic delays, and improvements to health primary care. So the first care service that will be improved is EMS, and the planned performance metrics include emergency department wait times, which is the time to the initial physician assessment, and 90th percentile wait times for the most urgent calls, which are the life-threatening calls. This document includes the end point of these time intervals, but I'm hoping the minister can define the start time when the clock begins on especially the emergency department wait times. Because it's an interval, we need to know when it starts and ends. And we understand that this has changed over time so that the wait times are not exactly what they were in the past. I also note that the goal for this year is to to improve upon the times from last year. And I believe that Albertans deserve better than such a modest target. This target is far below what is clinically recommended. And it's notable that performance last year was worse across all 4 categories. In some categories, it was substantially worse. For example, EMS 90th percentile response times for life-threatening calls in metro communities rose last year from 14.6 minutes in the 2023 year to 17.5 minutes in 23-24, and I'm hoping we'll do better than just get those fairly bad times down. It's also noted in the business plan and estimates document that the minister budgeted $730 million for EMS and expects the system capacity to increase. The stated initiative on page 69 is that in 2024, $730 million is budgeted to increase capacity and address the Alberta Emergency Services Provincial Advisory Committee, EMS Dispatch Review Committee. So I'm wondering what accounts for the difference between this figure of $730 million, 0.2 and the operating costs for EMS. Which is $617,797. There's around $100,000 difference, and I'm hoping to know what else is included in that. I also note that the EMS operating cost is decreasing by about $9 million from that was budgeted last year. And I'm wondering what will not happen or what's being cut to account for this decrease. I'm wondering if the minister is proposing to save money by contracting out, and will the contractor employ paramedics or perhaps people with less training and therefore less expensive, I assume. It was recently announced that the government and AHS are contracting interfacility transfers to Medavie, and I'm wondering how the Medavie contract will assure that Alberta does not experience the same problems that New Brunswick faced when they contracted to Medavie. As per the 2020 New Brunswick Auditor General's report, Medavie was still able to collect full payment while clearly underperforming. So I'm wondering how we're going to assure that we're not paying for something we're not getting. In addition, according to frontline staff, Medavie offers inferior jobs without benefits, resulting in high turnover. And I'm wondering how Medavie will be required to offer stable service, and that we can prevent this from being another contracting out to a private company failure like we saw with Dynalife. Also, how is the minister protecting Albertans from both failed service and an expensive bailout using public funds? So the EMS forecast for 23-24 is also considerably lower than budgeted. Can the minister explain why much less was spent on EMS than expected? We do know that sick time in EMS runs at over 20%, and many ambulances are commonly out of service as they cannot be staffed. And so I'm wondering if this lack of staff is due to poor retention and or poor recruitment. What measures has the minister taken to ensure better staffing this coming year? Paramedics in Alberta are amongst the lowest paid in Canada. We're also desperately short of paramedics, and retention is a major concern, as the average career of a paramedic is less than 10 years. The failure of retention contributes to a shortage of paramedics, which then contributes to longer ambulance times. So what funds have been allocated to retrain and recruit paramedics? So mental health concerns, specifically PTSD, are a major issue for EMS. They impact wellness and retention. The EMS Advisory Committee report included some additional recommendations on mental health. They noted these would be to enhance the ability of EMS staff to take scheduled breaks and discretionary time off, to move away from core and flex staffing model, to move away from extended on-call shifts for air ambulance, to develop options to expand the availability of shorter work shifts, and to work with system partners to enhance access to mental health supports. They also suggested establishing requirements for entry to practice for after mental health breaks and for resiliency training. So I'm wondering what the specific actions the minister has taken to support the mental health and wellness of paramedics, not only to help them, but to improve retention, reduce absences due to illness, and to improve work performance and safety. The next item I'm going to talk about is reduced lab and diagnostic delays, which is one of the other goals in Key Objective 1. There are no initiatives or metrics listed. This doesn't enable Albertans to look for accountability. Will the minister how will the minister measure success and monitor that we're making progress? So given that pathologists and lab physicians now working for APL, which is a wholly owned subsidiary of AHS, have had their workloads dramatically increased beyond recommended workloads for safe care, and that this leads to burnout and risk of medical error, what is the minister doing to rectify this? Pathologists' salaries are not adjusted for the extra workload, and I'm wondering if this is to save money or if this will drive pathologists to burnout and potentially away from Alberta, as we already have a shortage. How will the diagnostic delays be improved with this situation of shortage of pathologists? And how will improvement be achieved and recognized in the overall budget if it's only increasing by 2%, which does not match population growth or inflation, when we already know there's been a huge surge in demand for medical services, and equipment costs and servicing costs are impacted by inflation? Will the public again be starved to make the case to contract out services, and why are adequate funds not being allocated to deal with the increased volumes and the increased costs? I'd like to understand what the minister's plan is for this. Thank you.
Thank you so much, Honourable Member. We'll now turn it over to the Minister for her response.
Great, thank you so much, and lots of great questions in there, so I'll try to get to as many as possible and hope to answer all of them. So when we look at the EMS response times and, of course, all of the associated factors that are in there, we know that every minute counts during a medical emergency, so we need to keep improving on the response times that we currently see. So we look at the fact that we are seeing improved response times in a number of areas. We have added additional staff members. We are spending record amounts in EMS, totaling $730 million in the 24-25 year. We are seeing that response times continue to go in the right trend in the right direction. The response time to 90% of life-threatening events in metro communities in December of 22 was 18.4 minutes. It has improved to 14.7 minutes in December of 2023. However, we know there's still more work to be done, especially in our rural communities. We are looking at all of the options. We have repeatedly raised concerns about increasing issues within EMS, and that's why we put together the Alberta Emergency Medical Services Provincial Advisory Committee. In fact, we will call it APEC for short, but their recommendations are actually is what is leading us in our ability to make improvements within the system. So their recommendations included exemptions to emergency health service legislation, allowing emergency medical responders to work on emergency ambulance to increase the number of ambulances on the road, which we've done. We've increased more ambulances on the road. We've added 470 new EMS staff in 2023. 362 are paramedics, and this is an overall increase to a number of 1,790 between 2019 and December of 2023. So we've added an additional 1,790 EMS. We're currently have 2,150 full-time and 385 part-time FTEs. We have 400 new staff for 24-25 alone already budgeted for in our new budget. So we want to make sure that there are timely and safe handoffs. Another one of the recommendations that were proposed by the APEC committee. And so we have reduced the time that it takes for an ambulance when they drop off at a hospital. We've added nursing staff to accomplish this. And what we did in 2023 was add 114 full-time equivalent nursing staff and allied healthcare professionals to emergency rooms in the 16 largest hospitals and some suburban hospitals to ensure the transfer of responsibility for patient care from paramedics to ED staff is safe and fast. This supports the target of reducing the time paramedics spend at the hospital to 45 minutes. So 19 12-hour shifts were added also in 23 in Calgary and 20 in Edmonton. To staff these new shifts, EMS hired 80 new paramedics. 2 were added in Lethbridge and Red Deer in spring of 2023. So in 23-24, Alberta's government is providing the $736 million, and we've added more to that. Again, how can we continue to support our EMS workers? We are adding additional dollars and supports for mental health. And we know that this is of concern for our EMS service providers. Mental health supports for EMS staff have increased to improve their ability to best support frontline staff, create a more positive workplace culture, and improve how the EMS system functions. In addition, AHS EMS has implemented the EMS Fatigue Management Initiative to reduce fatigue-related service outages. And we want to make sure that they're well looked after, because when we have a workforce that is supported, we know that they can perform better. And overall, it keeps our emergency responses moving more appropriately. When I look at the retention, we are continuing and contracting. We are continuing to add more supports in these areas. Just want to make sure I don't miss anything. When you talk about the data having changed, we're actually making sure that we standardize it with CIHI data. And I know that my Assistant Deputy Minister of Acute Care, Chris Nickerson, has been working extensively in this area. So I'd ask him to come to the microphone and speak a little more to the data and some of his work that he has done as an EMS operator himself.
Good morning. Chris Nickerson, Assistant Deputy Minister of the Acute Care Division at Alberta Health. Thank you. This topic is very important to me as a former paramedic, so thank you for the questions. I'll try to answer the questions. I did write as fast as I could. As far as the hospital offload time, that time interval is measured from the time that the patient is triaged in the emergency department to the time that the patient is transitioned to an emergency department staff and the paramedic stretcher is clear and available for the next call. believe there was a question, sorry, excuse me,
Concerning,
the business plan and performance reporting. As you noted, the ministry is currently using the trend-based targets to improve system performance year over year, which will allow for ambitious goals and expectations for the health system and commits to steady improvement of response time over time. However, as announced recently by Minister, I believe it was in November or December, the province and the department is setting clear provincial performance indicators, operational standards, and mandatory reporting requirements for EMS. These standards will apply to all service providers. The goal is to make sure we have a high-performing EMS system that is reliable, accountable, and follows best clinical practices. And quantitative targets will be set in the coming months and years as the performance framework is developed with a focus on decreasing emergency department wait times and decreasing EMS response times from year to year. One of the key pieces that we'll be leveraging, as Minister announced, is the new standing committee on EMS with a multitude of community and service provider partners. And we'll continue to find ways to reduce response times even further, especially in rural and remote areas. The targets for 24-25 for all 4 geographic categories are to be below the 23-24 results, as you noted, which will be calculated and shared later this spring as well. There was a question also on mental health supports and workforce supports in general. Mental health supports for EMS staff have increased to keep staff healthy. I will note this was a very key topic that was discussed, I believe, as Minister had mentioned, of the Alberta EMS Provincial Advisory Committee. A lot of focus on that topic. EMS leaders are engaged in leadership development activities to improve their ability to best support frontline staff, creating a more positive workplace culture, improve how the EMS system functions. In addition, AHS EMS has specifically implemented the EMS fatigue management, which I believe Minister mentioned, expanded the EMS peer support program, providing consistent peer training and clinical oversight to support paramedic resiliency and mental health. They have rolled out EMS peer support pocket cards, QR access codes, posters in every AHS EMS facility, peer support team member identifiers of part of the uniform, posted new resources online for staff with direct links to mental health supports, integrated resource into provincial EMS orientation classes, launched a dashboard to report on peer support utilization, and launched peer support experience feedback survey. And they've also rolled out the AHS Behavioral Safety Program training for all frontline EMS practitioners. I think that's all the notes I have. Thank you.
Thank you. And I guess I'll just end, because I know many of the members opposite are from Calgary, just to let you know that the median EMS response time in Calgary has consistently met the target of 8 minutes for the past 8 months, indicating sustained progress comparable to the pre-COVID levels. Edmonton is at 8.6 minutes at the 90th percentile. So again, we're moving in the right direction, but we know that more needs to be done, and we're very focused on making sure that we have the resources by our record investment into EMS to make sure that that gets done. Moving to the second question, and I'm sure I'll try and cover as much as I can, but I'm sure we will have to go to the next block for this particular one. On lab services, obviously when Dinah left, took over for Calgary and South.
Thank you so much, Minister. That's your time. We'll head back over to the official opposition.
Thank you very much. I'm going to continue, thank you very much for that, with just another question around lab services, so we can come back to it. There's also item 10.3 on page 111 of the estimates document, includes or really talks about lab and diagnostic services and medical equipment replacement and upgrades. And I note there's really no increase in this budget, yet there are long lists of medical imaging and perhaps lab equipment. I don't know about the lab equipment that require replacement as they get beyond their life cycle. What happens when things stop working? I'm aware of transports from Red Deer for CT scans outside of the city because the scanner in Red Deer is sometimes dysfunctional. And the new emergency department at Misericordia does not have a CT scanner, which requires a walk which is takes a nurse about 20 minutes through the hospital. It's on the other side of the hospital to the CT scanner in the hospital, and so that's time there and back with a patient. And that scanner is frequently broken down and out of service, which means that patients have to go to other sites. So it's hard to imagine in modern times that a big city hospital wouldn't have a CT scanner, but I'm wondering what the plan is for the money that's allocated here for this medical equipment updates. The next item I want to talk about is surgical wait times. Again, really important. We agree this is a important thing to work on. In the estimates document, the budget on page 110, the budget for acute care is increasing by less than population growth and inflation. And of course, surgical access is pretty dependent on a lot of it on acute care capacity. The budget also highlights $313 million for the Alberta Surgical Initiative to help increase the number of procedures performed in Alberta annually. This is on page 106 of the capital plan. Is this figure independent of line 2.4 on page 110 of the estimates document, which is the acute care budget? So is that on top of that or part of that? And I note that item on page 106 is quite a bit lower. So does that mean there's less capital going into the Alberta Surgical Initiative this coming year? So what will that expense be for? In addition to this $313 million noted in the capital plan, I'm hoping the minister can provide a list and cost estimates of each of the capital projects related to the Alberta Surgical Initiative. I'm guessing they might be a variety of projects across the province, but it would be nice to know where and what those are. I'm also wondering how service will be improved when there's no initiatives or performance metrics included in this. Just over a year ago, the chief administrator for AHS, Dr. Cowell, stated, "It's my hope, and I actually believe that we will be at a zero waiting outside of the clinical wait times by March of 2024. A few weeks later in estimates, the then minister stated our commitment, that's our commitment and our objective. But minister, we're 2 weeks away from that. Well, we're now in March, but not quite at the end. And I'm wondering if you can confirm how many Albertans are currently waiting outside of CIHI's clinical wait time standards for surgeries. For hip replacement, this is 26 weeks, knee replacement, 26 weeks, cataract surgery, 16 weeks. And then for clarity, these standards are measured as the time between the date when a patient and the appropriate physician agree to the surgery and the patient is ready to receive it, and the date the surgery is actually performed. These were standards when the minister, administrator, and premier made their comments. I also note that in last year's business plan, there was a performance metric, the percentage of surgical procedures that meet the national wait time, but this is not in the current business plan. Is this because the metric, or has the metric been changed? We know that the wait time from when a patient sees their physician and we know they're going to need surgery, none of that wait time is included in any of this, including, for example, a person being followed for cataracts who's now losing their vision and has to wait to see the ophthalmologist. That wait time is not included, even though it's known what is coming. Now, I'm wondering if the minister can clarify if the government has chosen to abandon accepted national standards and why these aren't any longer in the business plan so that we can measure performance. So will the minister commit that in future communications comparing previous years with current wait times, that we'll be able to see either both of the types of measurement, or at least ensure full transparency so that we can know what is being measured and what was being measured in the past. Will the minister also commit to reporting wait times for other surgeries, including gynecologic surgery? We know that there's data that exists, and there is concern that surgeries being measured are preferentially being performed rather than the surgeries where wait times are not reported. Will the minister report the number of privately paid surgeries being done in Alberta on non-Albertans in chartered surgical facilities so that Albertans can see the impact of permitting these same facilities to lure precious resources away from the medically required surgery for Albertans? Will the minister start reporting the number of canceled surgeries due to the lack of staff or inpatient capacity so Albertans can see the impact of the lack of hospital beds and the lack of staff? I have people telling me of 4 cancellations. They come from rural areas. They need to arrange childcare, transportation, change in their job status, come into the city, and then the morning when they've done all this, they're told that they're not going to be having their surgery and they have to do this all over again. So these cancellations are a very important metric. In 2022, the then Minister of Health stated there were approximately 460 anesthesiologists working in Alberta. In 2023, he confirmed that the number had dropped to 454 instead of increasing to address the backlog and the increased population. Given that the recruiting and retention of anesthesiologists is an essential component in increasing the number of surgeries being done, will the minister provide an update on the current number working in Alberta? And is there data on the FTE of anesthesiologists so that we know how many of them are working full-time, let's say? Or an alternative would be fee-for-service billings of anesthesiologists with and without GP anesthesiologists, so we can get a measure of the work being done rather than just the number of people doing some aspect of that service. Just with the last minute, I'm going to ask a couple of questions around primary care and then come back to that in the next one. On key objective 1.1 of which we're still talking about, the improving health care, there is no outcome or metric listed for outcome 1. Which is to improve primary health care. But there is one listed for outcome 2, so I'll skip ahead to that. In the 23 to 26 business plan, the performance indicator listed for primary care was the number of registered physicians in Alberta. That is the number registered to practice. Of course, we don't know if they're working in primary care, and we don't know how much they're working. In this year's plan, there's a new metric, number of practicing family physicians and registered nurse practitioners. It lists 5,523 family docs as of December 23, which is...
Thank you, Member. Over to the Minister for her response.
Great, thanks for all those wonderful questions, and happy to answer them. And I'll start with the Dynalife and lab services across the province. And there was no reason when Dynalife took over Calgary and South, given the fact that they already had been serving Edmonton and North for decades quite well, that when they won the contract and took over Calgary and South, that they were, should not have been able to do the same level of service. Unfortunately, what we saw and what I came into when I became the Minister of Health in June was that there was a degradation of services for Calgary and South. So we took immediate steps to work with Dynalife to try and improve services, but in the meantime, it became apparent that they no longer wanted to fulfill their contract and therefore we were able to negotiate a purchase of that contract. We also made sure while this was going on that APL, Alberta Precision Labs, would be able to help assist and make sure that we caught up on lab services across the province. And what we've been able to see since August of 2023 is that thousands of additional community lab appointments in Calgary were allocated and significantly reduced wait times. So appointments in Calgary increased from 16,766 in May of 2023 to 23,000 weekly in December of 2023, which was a 40% increase in appointments. Since September, APL has reduced wait times for walk-ins and scheduled appointments by 34% in Calgary. To current overall average wait times in the area is 18.3 minutes for 80% of the patients. So they continue to add more staff and are continuing to provide resources across the province. So again, we are looking to make improvements in that area, but I thank all the APL workers and specifically those that had to go through the transition, because I know transitions are never easy. So we want to thank them for the great work that they're doing. Lab for pathologists, those contracts are negotiated between Alberta Health Services and the pathologists themselves, their association, their representatives that negotiate on their behalf. So again, that is a negotiated contract. We certainly want to make sure that our pathologists are well compensated and that they are able to be well supported in the work that they're doing. But again, it's a negotiated contract that has to take place. We have seen that we've added $45 million in the 23-24 to improve access to CT and MRIs. That will continue. We've added 27,500 CTs and an additional 2,250 MRIs, PET MRIs. We also have added 4,100 radiology procedures as well. So we're continuing to move in the right direction, making sure that we add the and clear up the backlogs that we have seen that were created through COVID, as well as pressures on our system. And that is paramount to ourselves, because we know with good diagnostics, then you can get timely treatment. But if you don't have good diagnostics, then you can't get that timely treatment that you need. So we're going to continue to make sure that that continues to improve. On surgical statistics, surgical wait times. And I'm happy to report a number of statistics, because I know there were a number of questions that were asked in this area. So total volume of surgeries performed. If I compare it to the 2018-2019 year, there were 297,900 surgeries performed in Alberta in 2018-2019. We are on track to meet our goal of 310,000 for the 23-24 year, which is 2% higher than 2.7% higher than 2018-19 and 3.9% higher than 22-23. So CS volume comparisons, again, there's on the chartered surgical facilities, I know that was one of the questions, how are they performing? So in 2018-2019, you know, I draw your attention, that was when you were in government. The opposition was in government. So at that time, there were 41,000 chartered surgical facility surgeries done. And right now in 23-24, there was approximately 63,000, which is a 54% increase, 23% higher than 54% higher than 18-19, and 23% higher than 22-23, which means that we're reducing the wait lists. And of course, there were many added to the wait list, and in fact, I know of concern was the fact that I was talking to doctors and through COVID who were saying that they weren't even putting people on the wait list because the wait list was so long, and we don't want that to happen. So we want to make sure that we're improving on our surgeries, and we need everyone to work together, whether it's chartered surgical facilities, whether it's our hospitals where we've added additional surgical centers within our hospitals. We need everybody working together to bring these wait times. So we are seeing that fewer people are waiting outside of the clinically approved timelines. And I can share that in orthopedics, 2,650 people fewer cases were waiting outside clinically recommended wait times since the start of this documentation here. So that is compared from 7,233 cases in February of 2024 compared to 9,886 were waiting in March of 2023. So we're continually improving on those wait times. Again, approximately 25% more hip and knee arthroplasties have been completed. So again, making sure that they're being completed in the appropriate window. In 2020, end of 2022, wait times in this area were in around the 42%. 42% were completed within the window of a clinically approved. Now we're over 60% being completed in the window of clinically approved. So we're going in the right direction, but we need to go farther. And I could continue on with cataract surgeries, et cetera. The Chartered Surgical Initiative program, the capital program, the $313.1 million over 3 years is to continue that great work. So we have chartered surgical facilities right across the province. They're currently underway in Calgary, Edmonton, Lethbridge, Medicine Hat, Brooks, Tabor, Innisfail, Olds, Crow's Nest Pass, and Rocky Mountain House. But they do more than just create capacity, it also relieves strain on the overall system. We also know that this helps with people getting timely access, and not only once they get the timely access to the diagnoses, to the diagnostic imaging, et cetera, and then they get their surgeries, they also can then get back to their normal lives. And so many people want to get back to their normal lives. We see it, and I hear it on a regular basis. So the list, because I was asked for the list of capital initiatives to be funded for Alberta Surgical Initiative Capital Program. The Grand Prairie Regional Hospital fit out of shelved spaces for 2 operating rooms, Edson, new procedure room, Royal Alex Hospital in Edmonton, renovation of 2 operating rooms, the University of Alberta Hospital in Edmonton, renovation of 2 operating rooms, and anesthesia recovery unit, and the MDR area. The Rocky Mountain House Health Center, renovations for a new procedure room and development of a new MDR area. The Foothills Medical Center in Calgary, fit out of the PACU, install ceiling lifts in Unit 54, fit out of shelved space for 11 new operating rooms and renovating Unit 91. The Chinook Regional Hospital in Lethbridge, renovations for new operating room, renovations to an existing operating room, expansion of an inpatient unit to increase capacity by 4 beds, and renovations to the MDR area. Medicine Hat Regional Hospital, minor renovations to the pre-admission clinic, day surgery area, and inpatient unit. Upgrading 4 operating rooms at the Lois Hole Hospital for Women at the Royal Alexandra Hospital, Edmonton. South Health Campus in Calgary, build 1 shelled-out operating room. Royal Alexandra Hospital in Edmonton, upgrade 4 operating rooms at the Orthopedic Surgery Center. The Rocky View General Hospital in Calgary, operating room renovations for urology. Alberta Children's Hospital in Calgary, build out 1 shelled operating room. Foothills Medical Center in Calgary, modify existing operating room. Grey Nuns Community Hospital in Edmonton, renovate 2 operating rooms, day surgery and inpatient unit. Sturgeon Community Hospital in St. Albert, renovate 1 operating room. Misericordia Community Hospital in Edmonton, renovate and upgrade 2 operating rooms. Royal Alexandra Hospital in Edmonton, renovate, upgrade 2 operating rooms and ambulatory treatment center. The Royal Alex Hospital in Edmonton, upgrade 6 operating rooms in the diagnostic treatment.
And Minister, that's your time. Back over to the official opposition.
Thank you very much. Thank you. I appreciate the answers. I'm coming back to the outcome of numbers of looking at primary care. This year, the new metric is the number of practicing family physicians and registered nurse practitioners. And in the document, it lists 5,523 practicing family physicians as of December 23, which is quite discrepant from what is listed as on the College of Physicians and Surgeons website, where they have 4,400. And I'm I'm wondering where the metric comes from, what data is used to determine that. I also would add that the number of family physicians registered is really not a very meaningful measure of primary care service being delivered, because it doesn't mean that they're all delivering comprehensive primary care. If physicians leave, they tend to keep their license for a period of time until they know how things are going in the new place. If they retire or cut back, or if they change their work and perhaps just do surgical assisting. So we're not really measuring the number of active primary care physicians. I think that number would require a greater dig into the data that Alberta Health have, looking at the practice patterns of physicians. And so I'm hoping that that will be considered so that there'll be good data for further future workforce planning. Likewise, the number of nurse practitioners doesn't really reflect primary care, because most of the nurse practitioners in Alberta work in specialty programs and were trained as specialty nurse practitioners, and they're not really able to work in primary care. So it would be really great when we're looking at primary care to identify the actual work that's being done by the different providers. On page 77 of the fiscal plan, it says that $475 million is budgeted for primary care. Now, this does include $300 million for primary care networks, and I'm wondering how this differs from previous years. I couldn't find what the primary care networks have been getting year after year. Is this an increase, a decrease, or no change? It also is noted in the plan that the primary care networks will provide additional support while implementation of the MAPS initiative continues. So I'm wondering if they're being asked to do more during this period, or if that's what they've already been providing. How will this funding to PCNs be distributed? And are there any expectations attached to that funding? Will the refugee clinic in Calgary or the unattached maternity care clinic in Northeast Calgary, which were previously funded by the Mosaic PCN, be included as part of this PCN funding? Both of them are no longer going to have funding from their regular source, and they look after a very large number of patients. The budget on page 17 of the strategic plan also includes $200 million over 2 years for increased access to family doctors and health professionals. What is this for, and how much of it will be spent in 24-25 year? Is this for TELUS Health or an investment in our current primary care system? And is it for the teams that need to be developed to provide team care and increase access? Can the minister please outline exactly what this this $200 million is for? So if we look at the $300 million and the $200 million, we're down to, if we assume it's $100 million over 1 year, we're down to about $75 million left. So it does state in the document that there will be $15 million allocated to support the compensation model for nurse practitioners. I'm wondering how this will work. Will they be fee for service, or will there be a salary model, or what is going to happen? How many nurse practitioners will actually be available to work within primary care? And importantly, will they be allowed to still bill privately for medically insured services? Because this is happening now, that because nurse practitioners cannot bill for seeing patients other than patients directly, they are now billing patients for medically insured services, or medically required and insured services. I note that the program support for primary health care, item 5.1 in the estimates document, page 110, is increasing to about little over, it's almost $11 million. What is this for? Is perhaps some of it to improve the billing system that physicians are required to use? Because we know that's a really archaic system and has caused great difficulty in getting physicians and even optometrists paid. And there's been talk for many years on that needing to be upgraded. On page 17 of the strategic plan, it also states that there will be improved access to family doctors and health professionals. There's a promise to allocate $57 million over 3 years to help doctors and nurse practitioners working in primary care to manage the costs of increasing their caseload. And I'm wondering if you could explain how that funding will happen. And how will this improve access to family doctors or primary care physicians of any kind? And how do these amounts fit in with the line items in the estimates document? I'm really not sure where they are. If we assume about a third of that is over the first of 3 years, there's still about $30 million out of this whole package for primary care. If we go on to key objective 1.2, which is to look at improving access across the province, on page 17, there is of the strategic plan. The minister is promising to improve access for underserved populations, including First Nations, Métis, Inuit people, and there's funding of $10 million for some primary health care initiatives in Indigenous communities. That's also on page 77 of the fiscal plan. What are these initiatives, and how will the minister identify and support Indigenous individuals, as there really are no indicators listed here? And how will the minister know if they're successful? How will the minister support these communities in acquiring the capacity to deliver these planned services while respecting Indigenous ways of knowing and being? The initiative mentioned, I'm wondering how much that is for. Next, there are 4 other initiatives. On page 77 of the fiscal plan, $8 million for Alberta newborn screening, $10 million for a province-wide midwifery strategy, $10 million for Alberta Women's Health Foundation, $10 million for the Grace Hospital. I understand those are over 3 years. Do these take up the remainder of that $475 million? And if not, are there other items that I can't quite identify in the estimates document that are part of this package of money, and what might they be? Okay, just noting there are 4 important features of top performing countries as far as their health services. They provide universal coverage and remove cost barriers. They invest in primary care systems to ensure high-value services are equitably available to all communities. They reduce the administrative burden that diverts time, efforts, and spending from health improvement efforts. And they invest in social services, especially for children and working adults. And that is work done internationally, and I would reference the Commonwealth Report of 2021, which shows where Canada sits and notes what these features are that we need to keep focusing on.
Thank you so much, Honourable Member. We'll head back to the Minister.
Thank you so much, and I just want to finish up on the last questions that were sent our way. So I will continue with the Alberta Surgical Initiative Capital Program. The Mazakowski Heart Institute in Edmonton fit out 1 operating room and renovations to inpatient unit and fit out 1 shelled OR and additional beds, 18 to 25, to accommodate increase of cardiac surgical capability. The Cross Cancer Institute in Edmonton, renovation and upgrading of the operating area. The Brooks Health Center, upgrade and renovations to 3 operating rooms, surgical scrub space, clean and soil storage area and recovery space. The Tabor Health Center, upgrade and renovations to 2 ORs, recovery, clean, soiled, and sterile areas. 24, the Crow's Nest Pass Health Center, renovations and upgrades to 1 OR, theater, change rooms, etc. Cardston Health Center, renovation and upgrades to theaters, recovery room required. Innisfail Health Center, adding 2 operating rooms and required MDR upgrade. The Peter Lougheed Center in Calgary, post-anesthetic care unit renovations. The Foothills Medical Center in Calgary, renovate existing day surgery. The Walter C. Mackenzie Health Center in Edmonton, renovations and expansion of the PACU and renovation and relocation of the SD short stay beds. Walter Mackenzie Health Center in Edmonton, relocation of 20 recovery short stay beds and creation of space to expand existing PACU. The Walter Mackenzie Health Center in Edmonton, expansion of the existing PACU from 14 beds to 22 beds. Sturgeon Community Hospital in St. Albert, day surgery, same day admits, and 23-hour expansion. Fort Saskatchewan Community Hospital, renovations for day surgery and post-anesthetic care unit footprint. The Pincher Creek Health Center includes changes to the day surgery to improve OR access, 2 OR theaters, clean storage, recovery space. The Stettler Hospital and Care Center, creation of endoscopy suite, procedure room, and required MDR upgrades. The Red Deer Regional Hospital Center, new pacemaker insertion and ECT procedure room. The Ponoka Hospital, upgrade recovery and surgical support areas and required MDR upgrade. And the QE2 Hospital in Grand Prairie, renovation of the ambulatory care space for cataract surgery. As you can see, we have a very comprehensive list to improve our Alberta Surgical Initiative Capital Program outfits, and so that will continue. And again, we are wanting to make sure that we are doing what needs to be done to provide surgeries in a timely fashion in the clinically approved timeframes. And as I've said, we've seen the reduction of hip and knee replacements and to more surgeries being done within the allocated timelines. On workforce was the next question, and I know one of the questions that was asked was about anesthesiologists. And we actually have seen an increase in anesthesiologists by the College of Physicians and Surgeons quarterly report. In 2019, there were 252, and that went down over COVID, but we have seen that number climb back up again to 456. And I know that in recent months, Alberta Health Services has been able to, in fact, increase their numbers in this area. When we look at the health workforce, registered nurses, in 22, we had 38,265 registered nurses. In 2023, we've had 44,734. That's a net gain of 6,469, which is 14.5%. Licensed practical nurses went from 19,900 to 20,900, a gain of 1,001, which is 4.8%. Registered psychiatric nurses went from 1,478 to 1,506, which is a gain of 28, of 1.9%. And nurse practitioners went from 829 to 917, a gain of 9.6%. Overall, we've seen a gain of the registered nurse population to 7,586, which is 11%. And I do believe I spoke to that earlier. When we talk about physicians, family physicians, there are currently 4,379 family medicine specialists and 1,277 non-specialists, and I think that's the discrepancy that you're seeing within the College of Physicians and Surgeons, for a total of 5,656 compared to 6,082 specialists. So compared to the same time last year, this represents an increase of 135 family physicians, or 2.39%, and an increase of 196 specialists, which is an increase of 3.3%. So we continue to recruit and make sure that our workforce is where we need them to be. Obviously, we're competing with the rest of Canada and the world. We know that there's a demand for practitioners right across the province, healthcare professionals right across not just our province, but every province in Canada. When I met with the ministers of health last fall, this was something that we spoke at length about, because of course we want to make sure that we all have the supports that we need within our own provinces. And so when you are competing with other provinces, it does get a little trickier in that regard. When we look at what we're doing to actually recruit for our workforce, and if you could just give me a moment, we have so many recruiting initiatives. So we have AHS continues to be an employer of choice with competitive wages and benefits and offering meaningful career opportunities. We have been working with our partners within the post-secondaries, including the College of Physicians and Surgeons of Alberta and the Association of International Medical Graduates of Alberta to highlight opportunities and streamline the processes. So what the College of Physicians and Surgeons have done, if you go onto their website, they've streamlined their processes in getting internationally trained medical graduates to come to our province. We also have seen, and for those that are out of province, we have seen that they are reducing the barriers to having those individuals come and work in our province. We've also seen that they have been recently, as of the beginning of March, were able to allow for others than just Alberta Health Services, so communities and clinics now can individually recruit family physicians, and so I've already heard from some clinics that this is going well. This has aided in their process of being able to do that. We've got programs for rural health professionals in our Rural Health Professional Action Plan to support community integration, setting candidates up for success. We've removed the barriers, as I said, for internationally trained nurses, not only for physicians, but also for nurses as well. And kudos to the College of Nursing for doing that. We have a process to hire IENs. Which is also being expedited, reducing the time to hire from 2 years to 6 months, placing Alberta at the forefront of the IEN recruitment nationwide. As of February 23rd, AHS has hired 242 nurses. Of those nurses, 43 have successfully moved through the immigration process and have started working at the AHS site. So this is in reference to the IENs. In the last round of collective bargaining, the Rural Capacity Investment Fund was established to support recruitment and retention strategies in rural and remote areas in North, Central, and South zones. So approximately $17 million annually was allocated to the 23-24 budget to support recruitment, retention, and relocation incentives, as well as to support team and professional development opportunities for clinical staff in these rural areas. AHS has hired 84% of all registered nurses who graduated in Alberta up to Q2 of 23-24, and this number will grow as RNs and RPN graduates are hired between now and March 31st of 2024. So AHS typically hires about 90 to 95% of all of Alberta's graduates. I think that's worth noting. When we look at nurse practitioners in the province, we are seeing that nurse practitioners provide a valuable service. We know that they are wanting to expand their scope and their ability to do what they're trained to do. They're highly trained professionals that are able to provide the services that most Albertans need. And so we are currently working on a new funding model where it would allow them to have, be able to provide clinical services to Albertans that are, lacking in primary care.
Thank you so much, Minister. Before we head over to the Independent, let's take our 5-minute break. Let's take our seats. We'll now move over to the independent member for 20 minutes. So member, would you like to combine your time with the minister?
If we could go back and forth, if the minister's willing, I would prefer that.
Minister, what's your preference?
I'm willing to go back and forth if they want to go back and forth.
Sure. All right, now we'll move to 20 minutes, please.
All right. Thank you, Madam Chair, and through you to the speaker and to her staff for being here today and taking some really great questions and providing the answers. I'll start on page 72 of the Ministerial Business Plan, and we've heard a lot already this morning about physicians and some issues around that. I'm going to refer to the expense line item, physician compensation and development. It has increased about 8% this fiscal year, which is more than inflation. Can the minister explain the reason for this significant increase? And related to that, our doctors are a valuable resource in our province. If I'm correct, doctor salaries are not all the same. What is the average family physician and the average specialist currently being paid per year in Alberta? And how does this compare to other provinces in Canada and internationally, maybe referring to the funding model there?
Okay. Alrighty. I was waiting for the finish, but your question's complete? Okay, awesome. Well, so yes, thank you for the great question, and we are growing our physician compensation. We've seen a growth in physician compensation from 2019 to present for 24-25. It'll actually work out to over 21% in total. It was 5.3 billion in the 2019 year, and it's now going to be 6.6 billion. There's a number of reasons for this. One is that we were able to negotiate a contract with physicians in about approximately 15 months ago. That was worth 780 million over 4 years. Also, we are seeing our population growth, so there's more services being provided, and particularly when we pay on a fee-for-service basis, we are seeing additional services. We have also seen a growth in the number of surgeries that are being performed. As I said, we're on track to have a historic number of surgeries completed, at 310,000 surgeries, and we're budgeting for that amount and hopefully more in the 24-25 year. And so all of these together actually create a situation where we are, recruiting more physicians, so we're getting more physicians into the province. We have additional costs because of inflation and the cost of growth in our province, which is a good news story. As we all know, the fact that our province is growing is a very good news story for Albertans, and we will continue to make sure. The other piece that we want to make sure is that we're providing supports within the areas that physicians, where we have rural, remote areas where we need more physicians. And so we've got various programs. So we've got, of the 164 million for workforce planning to train, recruit, and retain healthcare professionals, we have 15 million annually for physician recruitment and retention. We have 12 million annually for the rural, remote, northern programs. We have 12 million annually for physician support programs. We have 20 million annually for the business costs programs. We have 38 million in 24-25 for physician training. The other piece that I can add is the fact that even though we did sign a negotiated contract about 15 months ago, we have seen at that point in time, I'm not really sure why, family physicians weren't prioritized by the AMA at that point in time. And what we've seen is there's been additional stressors on the family physicians, so therefore we're in current discussions with the Alberta Medical Association to provide a new funding model for family physicians. And what we've also seen is that because of the stressors that we're seeing across the province, we've added an additional 257 million to 57 million for the panel enhancement program, and I can get into more details on that if you'd like. But the 200 million is really about stabilizing family medicine over the next 2 years as we move into a new funding model, which is something that I'm hearing from family physicians they want across this province. So many factors as to why it has increased greatly, but I guess at the core of it is to say that we really value our family physicians and all physicians in this province. They deserve our respect, and they also deserve to be fairly compensated. When we look at because an aspect of your question was also how do we compare to other provinces? We are still funding comparably to other provinces, and in some areas are on the high end of certain specialties. When I look at in Alberta, in 2021-22, the average family physicians, I just want to make sure it's the family physician here. Oh, all physicians. So an average of physicians. In 2014, 2015, an average physician in Alberta made 424,000. Ontario, that same physician average was making 364,000. In Manitoba, 377,000. In Saskatchewan, 389,000. In BC, 361,000. In 21-22, our physicians' average was 444,000. Ontario was 373,000. BC was 400,000. Saskatchewan, 430,000. I could, share. So the average in Canada when in 21-22 was 398,000, and the average physician in Alberta was making 444,000. So we're still top of the line, 11% higher than the Canadian average in 21-22, and I know that has remained relatively steady. Did that answer your question?
Yes, thank you, Madam Chair, through you to the Minister. The next two are also on page 72. Expense line item infrastructure support is $89,452,000 for 23-24. This increases to $241 million for 24-25, and by 26-27 increases to $455 million, more than that, an over 250% increase for the budget. Can the minister explain this significant increase? And as well, under capital investment on page 72, can the minister elaborate on the line item continuing care? It is the smallest line item of the budget. So I'm just curious about that. And as well, your infrastructure support goes from 1 million to over 10 million, this being the largest increase of the entire budget. Can the minister explain these significant increases?
So infrastructure is, I can't overstate how important it is that our healthcare professionals are working in, quality, safe environments. We have a lot of aging infrastructure, so we have to make sure that we're looking after our aging infrastructure, but we also need to build new infrastructure. So budget 2024 includes $4.5 billion of capital funding over 3 years for health facilities and equipment, health IT projects, capital maintenance and renewal of existing health facilities, and Alberta Health Services self-financed capital initiatives. So what we have is included in this is $3.2 billion for health infrastructure and equipment, $512 million for capital maintenance and renewal of existing facilities, $85 million for health IT projects, and $747 million for Alberta Health Services, as I said, self-financed initiatives. So when we look at what is included in all of that, it really is to make sure that we're providing right across the province projects that are needed. So in the capital funding, we have $66 million over 3 years for the medical device reprocessing program. So that is the sterilization units that are within hospitals to sterilize the equipment that is used through surgery and et cetera. So we've got, this is phase 2, so we've already performed a lot of this work in phase 1, and we're continuing on with that work. In budget 2024, it provides an additional $20 million for EMS vehicle capital program, so that we have safe EMS vehicles on the road. We've got $25 million over 3 years for Beaver Lodge Municipal Hospital replacement. We've got an additional $17 million in capital funding to advance the planning for the new Stollery Hospital in Edmonton. We've got new capital planning for the Alberta Kidney Project in Calgary, and we have $88 million for social infrastructure planning through Alberta Infrastructure, aiming for a comprehensive and unified view of infrastructure needs for health services, mental health and addiction services, and social services across the province. As you can tell, and that's just a portion of what we're funding. We're funding so much more than that. On the continuing care capital, we will see, because we have an aging population, we anticipate, like right now, 1 in 7 Albertans are over the age of 65. Within 20 years, that number will go to 1 in 5. Albertans will be over the age of 65. So we have to make sure that we are building spaces faster than our population is aging. And we are needing to do that in a more really strategic way. So if passed, budget 2024 investments in continuing care will help create additional spaces across our province. We have $121.5 million in 24-25 as part of the total $654 million over 3 years for the continuing care capital program, which will add or replace more than 1,600 continuing care spaces. We also have $57 million in 24-25, $57.1 million, which is part of a total $103 million over 3 years to support the Bethany Continuing Care project in Calgary. We have $63 million in 24-25 as part of $113 million over 3 years to fund the Good Samaritan Society Continuing Care Project in Edmonton. We have $45 million in 24-25 as part of the total $69 million over 3 years for the Jean Swideski Center at Norwood in Edmonton, and a further $139 million is budgeted for the anticipated aging with Dignity Federal Bilateral Agreement, which I can say that I've been working very closely and well with Minister Holland, who's the Federal Minister of Health, and we're very close on that particular deal. I'm happy to say that we did sign the Shared Priorities Agreement just before Christmas, and we are continuing to do this good work on continuing care as well. So I believe I've answered your question in there. And if I've missed anything, please feel free to remind me.
Yes, thank you, Madam Chair, through you to the Minister. Shoppers Drug Mart in Lacombe just had their grand opening for their new pharmacy care clinic, one of over 100 in our province. Across Canada, there are less than 100 of these pharmacy clinics total, showing that Alberta is leading the way in utilizing the skill set of our workforce, specifically our pharmacists in this case. Some of the ailments these pharmacists can address are strep throat, minor skin infections, pink eye, UTIs, allergies, and even diabetes and cholesterol issues. This service takes a tremendous load off of our doctors, freeing them up to deal with more acute cases that they are trained for, and relieving some of the burden off of our emergency rooms. This is good for doctors, good for pharmacists, and ultimately good for Albertans and our health care. How does this budget ensure that a medical professional, whether it be a pharmacist, a nurse practitioner, or midwife, or something else, can be more accessible to Albertans?
It's a great question. We have really seen where, because of everything that we're seeing across the province and, as I said earlier, on workforce across Canada, we really need to make sure that every healthcare professional is working to full scope, and the ability for pharmacists to work to full scope and provide primary care that falls within their scope makes sense. And so when we have roughly about 220,000 people coming into the province in the last year alone. Great news for Alberta because we're booming. We need those individuals to come and help our workforce, et cetera. But it does create a strain on a number of the ministries, including health. And so when we have everyone working together in team, whether it's a nurse practitioner, whether it's a physician, whether it is a pharmacist and a pharmacy-led clinic, then we know that Albertans can get access to the supports that they need in a timely fashion. So when we've got a compensation plan for pharmacy services, like we do not pay for their capital infrastructure. That is fully the responsibility of those clinics themselves. But knowing that if a patient or an individual comes in, an Albertan comes in, and as you say, has a sore throat, they can be tested quickly, and the pharmacist, within their full scope of ability, can actually prescribe for that minor ailment, and again relieve the pressure that's on our family physicians, our clinics, our primary care, or nurse practitioners. So again, this is a plus for Albertans. We are actually seeing that more and more services are being provided. In 22-23, over 6.1 clinical pharmacy services were provided to Albertans. That was up from 4.9 million in 21-22. So in just 1 year, we have seen roughly over 1 million individual services increase within that area. The compensation line item for pharmaceutical innovation and management has changed from the 23-24 year budgeted. We budgeted 140 million in 23-24, and in 24-25 that's up to 157.98 million. So we are seeing that Albertans like this, and they are wanting it. And the one area that I would say is, every community has a pharmacy, and if those pharmacists are able to work to scope, that provides greater access, particularly in some communities that struggle to get access to family practitioners and primary care.
Thank you, Madam Chair, through you to the Minister. Sometimes for reasons known or unknown, a patient attempting to receive health care in Alberta may be denied because of an inactive Alberta healthcare number. In these situations, doctors have the freedom to treat this patient and still receive funding based on good faith billing legislation. Good faith billing was removed in March of 2020. In subsequent years, it was promised to be reinstated but was not. This UCP government recently committed to reestablishing good faith billing. What line item reflects this expense, and will these payments be retroactive?
Yes, they are retroactive, and the line item is under budget 2024. And I'll just get you exactly where you can find it, but it is $2 million. I knew that off the top of my head. It accounts for approximately $2 million. And you're right, these are individuals that, are vulnerable individuals that need the help and support. Our physicians step up at a time when they're needed, and they provide that service, and they should be compensated for that service. We had a little bit of a glitch with the technical implementation of this, but my understanding is that we're working through that, and that those good faith payments have been reinstated, and they're retroactive to April 1st of 2022. And physicians and billers have been able to submit their outstanding claims and have those compensated, because we do want to make sure that they are looked after in that regard. So it's $2 million under the physician compensation line item.
Okay. Thank you, Madam Chair. To the Minister. On January 1st, 2021, the government, through Bill 47, removed the ability for healthcare workers to apply for a WCB following a workplace trauma. Is there a plan to reinstate presumptive legislation to ensure the full care of our frontline workers, and what would this cost be going forward?
I don't have that on hand at the moment, but if I could come back to that question, please.
Sure. Yeah, if we could get that later, that would be great. Thank you, Madam Chair. To the Minister. I will, in light of time, I'll end with my constituency needs, especially in Ponoka. The ER has received a little bit of a facelift, as you have already mentioned, and as the Minister has already mentioned. And this has made a difference also with 2 new doctors coming to Ponoka, where we were seeing weekly ER closures, and it hasn't happened since before Christmas, and this is really good news. Can the Minister speak to what else might be happening in the riding of Lacombe-Ponoka with capital projects or operational projects?
So going back to your other question on WCB, I've been informed that that is actually a question for jobs, economy, and trade. So that would fall under their purview. And on the new physicians for Lacombe, Ponoka, and other areas, we'll just have to break it out. As you well know, with the long list that I read out to you on capital, we have a lot happening across this province. And I'm happy to actually, if you want, get back to you, because we're not finding it right at the tip of our fingertips, but we will be happy to get that information back to you directly.
All right. Thank you, Madam Chair. To the Minister.
Thank you. We'll move over to Government Caucus now for their 20-minute block. Members, would you like to combine your time with the Minister?
Sure.
Minister, what's your preference?
Sure.
All right, let's proceed.
All right, thank you for the opportunity to ask some questions today regarding this year's health budget. Healthcare is consistently the largest budget allocation by far. So we have a lot to unpack today with the Minister here. This year sees an operating budget of $26.2 billion for the Ministry of Health, which is about 1.1 or precise $1.1 billion increase, and it's 4.4% from the 2023-2024 forecast, as we see it on the page 76 forecast, our fiscal plan. This investment reflects this government's commitment to healthcare in this province, and I'm proud to see this. So thank you, Minister. This government has some big priorities around Alberta's healthcare system, and I'm happy to be able to spend time to discuss healthcare today. Healthcare is one of the most important issues facing Albertans, and I would like to start by thanking the Minister and her department for the continued hard work trying to fix these issues facing healthcare system in our province. Some of these continuing issues are the delivery of services and the performance of the Alberta healthcare services that our public healthcare provides. I'm sure that all of us here have heard from our constituents about some of the problems facing AHS, our Alberta Health Services, and how healthcare is delivered in the province. Some of the examples would be from my own riding of Drayton Valley, Devon, where people are not able to give birth to their babies locally in the hospital unless this is an emergency. And if it's not an emergency, they would have to drive all the way to Edmonton. And since 2015, we have more babies born on the side of the road because of the shortages created. So our constituents are super excited and thankful to the Minister and your department for the AHS refocusing initiatives. And in general, Albertans are excited and grateful for your AHS initiative for focusing. So some of my questions would be from page 77 of the fiscal plan mentioned the strong role AHS will continue to have on the health system. So how much of increase in budget has AHS received? And can the Minister provide some clarity on the types of programs and services Albertans can see being added and improved with these dollars?
Thank you for the questions. So yes, you're absolutely right. We're seeing, our population grow, and as I said earlier, we have an aging population. It's resulted in increased demands across the whole system. In 24-25, population aging and patient complexity are projected to increase by 3.6%. So these factors have a direct impact on key services, including emergency departments, visits, EMS events, and births. Investment is also being made into the priority areas such as increasing continuing care capacity and opening of the Arthur J.E. Child Cancer Center to patients. That is a state-of-the-art facility that will just be so impactful for Albertans and cancer care. I'm excited to see that fully opened in the fall here. In addition to population aging and patient complexity, increases are also required to support wages, including overtime and agency nursing, inflation for clinical contract providers, supplies, and utilities. AHS will need to prioritize and find savings and efficiencies to manage these increases. But AHS is also looking to find efficiencies and opportunities to meet the needs of patients throughout modernization to help enhance system efficiency and optimization. When you ask about the overall funding, and I have to pull it up because I am always, I'm very pleased with this number. In 22-23, we had, under the statement of operations, we had the health's consolidated expense estimate was $25.225 billion. For the 24-25 year, it's going to be $28.373 billion. So this is a 5.1 increase from the 23-24 year. This is needed, as I said, for all of the reasons I've just shared. We've got a vibrant community, and we need to make sure that we have excellent healthcare services. So that's the reason for the added dollars within our healthcare budget. We recognize that we need excellent healthcare, and every Albertan deserves excellent healthcare.
Thank you. With my next question, I also would like to focus a little bit on our AHS refocusing initiative, as it's something that is very important for my constituents and Albertans at all, in general. So something that I am particularly proud of is this government's efforts to improve our health system. As announced on November 8th of 2023, the Ministry of Health is planning on refocusing healthcare. This refocusing initiative includes the creation of 4 new organizations, and they break down into acute care, continuing care, primary care, and one of the most important one to me would be the mental health and addictions. Within a singular unified system that you're creating. This being done to ensure that services are more focused and effective. It will also ensure that frontline healthcare workers can get the resources they need and will modernize the way healthcare is delivered. I see on page 70 of the business plan, key objective 2.2 discusses the need to engage the health workers, patients, families, caregivers, and system stakeholders to understand frontline and local perspectives. And thank you for your engagement. I have opportunity to be one of them, and people are saying that it's the first time in a long time they've been heard from our health and Minister of Health. So these engagements would be critical to effectively implement the healthcare system and refocusing initiative. My question would be, with system refocusing at an estimating cost of $85 million, is the minister able to provide and update on the ongoing refocusing initiatives?
Yep, happy to do that. And I'm very excited about the work that's happening within the refocusing. As you rightly indicated, there needed to be a revamping of the system. When I became the Minister of Health, it was very apparent that the structure needed to be looked at. And when we announced the refocusing, it was exciting to see the engagement across the province. Not only did we hear from people online who attended the town halls, we had numerous town halls. I believe there were approximately 8,000 people that attended those online town hall meetings. But then we went into the in-person here starting in January. We've had over, or fast approaching 60 sessions, in-person sessions across the province. We've had over 1,800 to date healthcare workers and Albertans who've attended those sessions. The vast majority are healthcare workers. And I stand corrected, the town halls, we had over 10,000 participants. We've had nearly 18,000 healthcare workers and Albertans provide feedback online, so there's an online survey as well. All of this is very important. I really believe we need to hear from the front lines. It's often the front lines who actually know the system the best in terms of having practical solutions and at the very least identifying the problems. And I've seen that. I've attended well over half of these sessions that have been provided in person. And I'm hearing from whether it's doctors, nurses, healthcare aides, managers, that there is a long list of issues that need to be addressed, and we have to include the workforce in the solutions. And so I'm excited for that work that is being done. And we're going to continue that. We've actually, as we've been going across the province, said, you know, we're hearing from you. We're going to come back, and we want to come back in a year's time and say, this is what we've heard, this is how we're addressing what we've heard, and this is the progress we've made, and this is what still needs to be done. That $85 million was allocated because we went back to 2008 when Alberta Health Services was first created, and we were able to surmise from what was spent at that time and kind of budget for it. But we feel that very confident that those dollars actually will meet the needs that we have during this refocusing effort. Not only are we engaging with Albertans. We also have dedicated engagement sessions for First Nations, and our Indigenous leaders and partners. And so there's a lot of work that's happening underway. And as you said, having 4 areas that are focused, laser focused on their what will be within their purview, whether it's mental health and addictions, primary care, acute care, or what did I just miss? Primary care, acute care, mental health and addictions, and in continuing care. Don't want to forget continuing care. We're having record investments in continuing care. And all of these were actually formulated from a lot of engagement that previously existed. We have numerous reports, whether it was the Modernizing Alberta's Primary Care System, the Modernizing Alberta's Primary Care Indigenous report, or the continuing care reports, the various reports there, or the EMS reports. All of those factored into the improvements we're making on refocusing. So all this to say, there's been a ton of work. There's more to be done, but at the end of the day, we want to ensure that we have excellent health care for Albertans. We want to improve the surgery wait times, that they will actually decrease, that everyone will get their surgeries within their recommended timeframes. We were going to put strong metrics in place to make sure that EMS is able to respond in a timely fashion, but also offload patients in a timely fashion at hospitals. We want to make sure that Albertans, when they go to see a family practitioner, actually have a family practitioner to go see. We know that right now, roughly about 700,000 people don't have family practitioners. That's why we need to have the nurse practitioner program, the pharmacy-led clinics, and of course, we need to make sure that our family medicine practitioners and general medicine specialists are able to provide good service to Albertans. A lot of work to be done, but I've got an excellent team, many of whom are sitting right behind me here, all dedicated to making sure we get those, we achieve those outcomes that we're gearing towards.
Thank you. In my next question, I would like to address a little bit question of access to health services, as well as the wait times. I know we talked about it a little bit, but I want to kind of go a little bit more in details. One of this government's key healthcare priorities is to improve access. Service only benefits people if they can use them and get to them, which is why this topic of access to healthcare is so important to me and Albertans. And time is a significant component of this. Those seeking services need to be able to access them within a reasonable time frame. In fact, this is a concern my constituents often raise to me. Things like surgical wait times, which can significantly affect their day-to-day lives. According to page 69 in the business plan, key objective 1.1 indicates increased access to healthcare services for Albertans by improving the emergency medical services, our EMS system, reducing surgical wait times, decreasing emergency department wait times, and last but not least, reducing laboratory and diagnostic services delays. Can the minister please, through the chair, indicate what investments are being made on improving wait times for surgeries, and how will that money improve wait times?
Thank you. Happy to reiterate some of the things I've already said, but add a couple of new pieces. The Alberta government provided an $80 million increase in funding to add an additional 20,000 surgeries in 23-24. As I indicated earlier, over the next 3 years, AHS will spend approximately $312 million to support a projected 310,000 surgeries in 23-24, and we've got $316 million on surgeries in 24-25 and $324 million on surgeries in 25-26. So we'll continue to see those surgeries improve in terms of the numbers and the times. The Alberta government we're also providing an additional $237 million over 3 years to add and expand operating rooms in hospitals across the province to boost surgery capacity in Brooks, Calgary, Camrose. I'm not going to go into that whole list again. I don't think you want me to repeat it. It's quite a lengthy list, but I'm very proud of that list. Additionally, we've got $13.5 million is being provided to rapid access clinics for faster assessments for musculoskeletal conditions to determine if patients require surgery. And again, this is one of those things that orthopedic surgeons are telling me actually helps to decrease the wait list, because people can be assessed quickly to determine whether they actually do need to move on to surgery rather than waiting on a list, or if they don't, perhaps they need physiotherapy or a number of other interventions, they can get those non-surgical interventions done in a more timely fashion. We continue to add more resources to the front line to reduce EMS response time. So in 2023, EMS hired 470 new staff members, including 362 paramedics, which that's close to a 17% increase in EMS staff employed by AHS between December of 2019 and December 31st of 2023. We continue to implement recommendations of the APAC report and dispatch review to improve EMS and support the workforce. And further, we have established new Alberta EMS Standing Committee made up of frontline paramedics, municipalities, and Indigenous representatives and other key community partners. So this new committee will provide advice on all aspects of the system, including air ambulance, dispatch, ground ambulance, and medical first response. Its work includes reporting to me on progress on implementation of the recommendations from APAC and the Alberta EMS Dispatch Review. So you can see we're putting a lot of concentrated efforts to make sure that we've got the right people at the right tables, and also the right people in the workforce doing the jobs that are required to meet the needs of Albertans.
Thank you very much. These are the top questions that I had for my constituents and most Albertans. Access, wait times. So the rest of my time block, I have a couple of minutes here. I'll probably just cede it to my colleague, Brandon Lanty from Leduc Beaumont, if that's okay.
All right, thank you, member, and through the chair, thank you to the minister. Certainly appreciate your department's hard work on this file for Albertans. Certainly hasn't gone unnoticed in my riding. We'll try to get my question in the last part of this block. It's actually on the Canada Health transfer. And I know you are doing some ongoing active work with consultations with the federal government. And so on fiscal plan outlines on page 64, the transfers from the federal government, including the Canada Health transfer. Does this include the new bilateral agreement with the federal government? And if not, when would we expect to see that? Thank you.
So thank you for the question, and as you probably are aware, the premiers across the province have really been pushing the federal government to meet their commitments. In the past, the split between province and the federal government was about 50-50. Now we're at roughly about 25%. Currently, we're at 22 with the shared priorities and the aging with dignity. That brings us up to about 25%. But the premiers were all pushing for to increase that to 35%, which brings it closer to where it should be. And so those are continual conversations that we as ministers of health have with the federal minister to support, to fully fund and support the programs that we have here. Health is a provincial jurisdiction, and while there's opportunities to partner with.
Thank you so much, Minister. We'll move back over to the official opposition to start with their time.
Thank you, Madam Chair. I'd like to have some questions. I'd like to go ahead. And just thank you to the Minister and all the public servants who, of course, are working so hard to make sure that Albertans have the service that they deserve. I want to reference in the estimates 2.1 and also in the business plan 2.3 key objective and just talk about recently, we found out that a patient in a wheelchair requiring supportive living was transferred from the Royal Alex Hospital to a motel for that supportive living. According to the budget, $1 billion will be spent over 3 years to transform continuing care. Per the fiscal plan, this investment will be in part shift care to the community. This is also outlined in the business plan objective 2.3. But in fact, last week, the minister put out a release touting the reduction in wait times for alternative levels of care of patients, and the push to move patients out of hospital faster. Can the minister please explain how much of this $1 billion investment is expected to go to social services in motels? Some people are calling it motel medicine. Is the motel considered an innovative, small continuing care home, or one of the 150 temporary spaces of the 1,500 expected to be online by 2025, according to Budget 2024, release of March 14th? Given that the patients in the motel were under the care of an approved community partner, what processes are in place to ensure the safety and well-being of patients as well as prudent use of taxpayer money? And how does holding patients in a motel without access to healthcare workers fit with outcome 1 of the business plan of a safe and responsive healthcare system that provides Albertans with the necessary care when and where they need it? Also, performance measure from the business plan 2B talks about the percentage of clients moved to continuing care homes within 30 days of being assessed. And I'm just wondering if the travel lodge placement, this motel medicine, does that fulfill this measure according to your business plan? Also, how many clients or patients does the agency that was providing services in the travel lodge have? And how many other motels are being used for patients in the province? And what policies and procedures are being properly followed, as the minister had said previously, when patients end up in motels, especially those using wheelchairs, needing support with hygiene, and of course, having proper food. So I just wanted to start with those questions and then go on to some further questions about continuing care. And again, it's line 2.1 in the estimates budget, which covers operating costs for facility-based continuing care delivered by Alberta Health Services or contract providers. Certainly one of the questions in the community is whether the government will sell public facilities such as Care West and Capital Care. Can the minister tell us, will more continuing care providers be for-profit as the government sells off public facilities? And we know from the Auditor General's report regarding the best outcomes for residents living in continuing care during the pandemic were those in public facilities. The highest number of cases of COVID and deaths due to COVID-19 were in for-profit facilities. Is the minister using this information in her planning for the delivery model of continuing care in Alberta? And where do we see those plans reflected in the budget? In 2020, so some time ago, the facility-based continuing care report was completed. This report was a guide to improve care. We're now in 2024, and the issues remain the same. Inadequate staff to resident ratios, staff qualifications do not align with resident needs, reports of neglect and abuse and overuse of pharmaceuticals. I've heard from Albertans across the province of the poor service for themselves or their loved ones in the continuing care system. Last year, the previous minister and I discussed the many shortcomings in our system. Residents are not being given enough time by staff. In turn, staff are not allotted enough time to complete their duties due to unrealistic demands of employers and increased responsibilities due to high rates of absenteeism and vacancies. The facility-based continuing care review assessed that residents are not being given enough hours each day. The accepted standard is 4.1 hours of daily care. The regulations for Continuing Care Act were just released a few weeks ago, and they don't even have an allotted time for care hours. 7.3 in the accommodation standards and licensing in the estimates refers to these questions. The previous regulations had 1.9 hours of daily care.
Thank you so much, member. We'll head over to the minister for her reply.
Thank you for that. And yes, we are making record investments in continuing care because, as you indicated, there is a need. There's a great need. As I said earlier, we have an aging population. Currently, 1 in 7 Albertans are over the age of 65. And we know that in 20 years, that is going to change to 1 in 5 Albertans. So beginning in 23-24, the ministry made a 3-year strategic investment of $1 billion to transform the continuing care system by supporting initiatives that will enable more people to receive care in their homes and in their communities. We want to enhance the workforce capacity and increase choice for Albertans and prioritize quality of care and quality of life as well. And I would, I know that you would agree with me that many Albertans want to age in place. So we have to make sure that we have the ability to help them with home care and all of the other needs that they have. So this is a huge investment right across Alberta. And what happened to the individual that you referenced earlier, this patient that was housed in a hotel by a nonprofit provider that when Alberta Health Services and the patient had their discussions, they came to that individual chose that particular site. That is the reason why we made the announcement we did last week, that we need to actually have a more targeted approach. We need a cross-ministry approach. Obviously, we need to make sure that every person who leaves hospital is able to find the right level of care within the community or within their home. So we are making, as I've said, record investment. We are taking a cross-ministry approach. We've added a task force. What I can tell you is that you mentioned alternative level of care patients in this province. And I guess I should go back just for a second. We have in our hospitals over 500 patients each and every day that are successfully discharged from hospital. And I want to make sure that, I give a lot of, kudos to our healthcare professionals who work so diligently each and every day to make sure that patients get care while they're in hospital, and that when they're looking to transition out, that they are given supports and information and care as well, and that then when they leave hospital, that they're given care. On average, there are approximately 1,500 Albertans who have finished their required hospital care and are waiting in hospital beds. These are the alternative level of care patients. While we know that almost half of these patients are transferred within 7 days from their hospital beds to more appropriate care settings outside of hospital, such as continuing care, and the majority are transferred within 25 days. We also know that there are a smaller percentage of patients with more complex needs that are experiencing delays and stay in hospital much longer than required. And so, is this unique to Alberta? No, it isn't. Alberta is among the best performers in Canada related to managing alternative level of care ALC patients. The government is taking action to reduce the wait times for these patients to be transferred to a more appropriate care setting, such as a long-term care facility, community support facility, or be set up with appropriate home supports. We know that there's lots of work to be done. I am a rehab practitioner by profession, and if anyone knows me, they will know that the drum that I've been beating since I have become a minister, whether it was the Minister of Education and now as the Minister of Health, is that we need cross-ministry approach. We need to make sure that nobody falls between the cracks, and we need authentic wraparound services, and that is something that I'm very focused on. So to that end, in this particular case around alternative level of care patients, we've developed tactical teams between the ministries of seniors, community and social services, mental health and addictions, Alberta Health Services, and Alberta Health. And we've brought in other ministries as needed. If someone is missing their identification people have
Thank you so much, Minister. We'll now move back over to the government side for the rest of their questions. 5 minutes, members. Or if you're sharing, it's 10 minutes. Yeah, please proceed.
So are we?
If
back
it's
in-
up to you and the minister.
Okay,
Minister, would you request a sharing time?
Sure, we can go back and forth.
Okay, go ahead.
Yeah, thank you, Madam Chair, and through you to the minister. I just wanted to give you the opportunity to pick back up on the Canada Health transfer issue, and you were referencing some of the work that you do with your provincial colleagues, and I believe you were just reiterating, of course, that healthcare is a provincial responsibility, something that's very important, but certainly would be interested to give you an opportunity to finish your thoughts on that important work and what you're doing cross-jurisdictionally and how that impacts the Canada Health transfer and the items in the budget on those transfers, including our new bilateral agreement. Thank you.
Thank you for that. As I was saying earlier, while the premiers had really been articulating to the federal government that they wanted them to step up, the federal government did not come up with that full 35% that the premiers were asking for. Again, that would have been down from what originally was anticipated when agreements in Canada Health transfers were first thought of. But they have come up, and so we have seen that there is a 10-year funding commitment to the provinces. And one aspect of the 10-year funding commitment that was included was the shared priorities. And so we have seen, as I said earlier, that Minister Holland and myself, Minister Holland is the federal minister, we were able to negotiate that agreement. We collaboratively worked on it. Our departments worked on it. This agreement is worth Alberta's portion, I'm just trying to find the exact number here. In total, the federal government is providing $196.1 billion over 10 years, but Alberta's portion is $2.9 billion over 10 years, with a $1.1 billion issued as a lump sum for the first 3 years, which means that we will see approximately $643 million out of the $1.1 billion in this 24-25 fiscal year. And we are making good progress on the Aging with Dignity. I hope to be able to announce something in the near future. And, the federal government continues to be responsive. I know I've had very good conversations with Minister Holland, even as early as last week or the week before, I think it was, where we've talked about how we can work together for the betterment of all Albertans. Obviously he's looking at all Canadians, I'm looking at all Albertans, but I'll always fight to make sure that Alberta gets a fair deal in any of these negotiations that we have with the federal government.
No, thank you very much for that information. I might switch gears a little bit. Obviously, we've been having some conversations on continuing care, and I can tell you in my riding, this is certainly top of mind. I've had the pleasure of touring a couple of our seniors' lodges, and one of the questions I get asked about is, what does that look like when there's a higher level of care required? What maybe does that look like in a transition? Also, of course, talk to many frontline workers in Leduc Beaumont, in the hospital particular, and continuing care often comes up in those conversations. I would say people are very excited about the new continuing care focus under the refocusing. My constituents are certainly looking for improved access and healthcare outcomes under this refocusing. So I certainly feel that more information on this continuing care, continuing to emphasize it as a priority is super important. I mean, obviously, this issue is much more than coming up with a litter of phrases that may or may not actually be in this budget. So I did want to ask you if you could maybe dig in a little, and specifically, we're looking at line 7.2 for continuing care supports. We've already made reference to a dramatic increase, $141 million increase. I think that's really really important to highlight. This is a major investment for a continuing care initiative. So I did just want to give you an opportunity. Can you elaborate on what exactly these initiatives are and what impact they are expected to have on continuing care? Thank you.
I'm happy to. Thank you so much. So we've been working on reshaping the continuing care system based on the recommendations from the facility-based continuing care review, the palliative and end-of-life care engagement, and learnings from COVID-19. And all in those documents, we saw that there was a need for a modernization. We had 4 acts previously. We brought in a new Continuing Care Act last spring that really looks to modernize the system, kind of get rid of the red tape and some of the redundancies that were existed. It asked for, we now will have one piece of legislation that oversees everything. There is better oversight was asked for, and thus we are putting in the continuing care organization, which is going to be stood up shortly. In the regulations, there was an extensive engagement that were done on the regulations. So these are things that you will see in the new regulations that are updated that actual facility providers wanted in there. They needed the flexibility. So, but beginning in 23-24, the ministry made a 3-year strategic investment of $1 billion to transform the continuing care system by supporting initiatives that will enable a shift to more care in the community by investing in community-based services and supports to ensure Albertans are getting the care they need when and where they need it. We're enhancing the workforce capacity to ensure the appropriate workforce is available to provide care now and into the future. We need to increase choices available to continuing care clients and residents and encourage innovation among continuing care providers and operators and improve quality across continuing care. And I can tell you that the system out there, the providers out there, they're excited about the changes that are coming, that have been coming, and the ones that are coming, because we're making record investments. In 24-25, $377.7 million has been allocated through continuing care transformation investments to ensure more people are able to receive care in their homes and their communities. Workforce capacity and supports are improved upon, and choices for Albertans are increased. Pardon me. And quality of care and quality of life are prioritized. In addition, the government, as I said earlier, will receive $139.4 million in 24-25 through the Aging with Dignity bilateral agreement, and this is really to scale and spread continuing care transformation investments in enhanced home and community care, improved workforce capacity and supports, and quality of care in continuing care homes. Overall, these continued investments in continuing care transformation will provide a sustainable way to meet the increasing needs and demands for continuing care and will ensure the needs and desires of Albertans are met. And also, we want to make sure that people are housed safely, that they're in environments that are safe and appropriate for them, and that they have a good quality of life, because our seniors have given so much to this great province. They have built it, and they deserve our care and attention, and making sure that they have a quality of life into their final years.
Thank you very much for your answer. Yeah, certainly consensus in my riding is so important to support our seniors and to make sure that that they are receiving the care that they deserve and the care that that we are able to provide for them. A lot of times that means what's the best option, and oftentimes that means more care spaces being available. And so again, most of my constituents, a lot of whom are seniors, they talk to me about a lack of care beds in their communities. So I know you've spent a lot of time listing where we've made some investments, and we certainly appreciate that across the province. I was just wondering if you can touch on very, very quickly here in our block, some of the communities who might be receiving long-term care beds or upgrades to their beds. Thank you.
Sure, and that's something that we learned, we have to acknowledge that through COVID, we learned many things. And one of the things we learned is that some of the more ward-like room settings in continuing care homes are not appropriate. And so there's modernizations that need to be made so that individuals can have their own bed. And
Thank you, Minister. That's our time. We'll head over to the official opposition.
Madam Chair, yeah, I just want to go back to questions I asked earlier, and regarding Objective 2.3 and the business plan. I just would like to know how many other patients are at the Travel Lodge in Leduc and how many other motels are being used. And now I'd like to...
Go ahead, member. Point of order's been called.
Thank you, Chair. I believe that we'll call this under 23 C. The member opposite persisting in the needless repetition of the same question the minister has already provided an answer to. I believe that was something the minister answered in her last round of questions, and I appreciate moving on to something new for us and for the public to see.
Go ahead.
I don't think it's point of order. I didn't hear an answer previously from the minister on this same topic, and I think the member is appropriate to go back and just sort of want to clarify and understand it.
Well, thank you so much, members. I don't find this to be a point of order at the moment, so member, please proceed, and if the minister chooses to answer it, then we'll hear from her. Thank you.
Thank you. So those are those two questions. And now I'd like to move to the estimate 7.3 accommodation standards and licensing. And so, I mean, it's sort of understood that accepted standard for daily care hours is 4.1, around that. The regulations for continuing care did just come out recently. But there is no allotted time for care hours. Previously, the Nursing Homes Act said 1.9 hours of daily care, which of course is abysmally low. But now we have absolutely nothing identified. So I'd like the minister to explain this omission and include that should include the specified hours and regulations, and what is the government standard of daily care hours, and how is that funded in budget 2024. Also, I've heard numerous times that care providers, that the funding model underestimates the time needed to deliver quality care in seniors' context. Tasks often require more time. For example, helping a 98-year-old out of bed in the morning is not a quick process. Has the government recognized the need for higher staffing levels to provide responsive and compassionate care? And where is that reflected in the budget, and how many hours per day will be funded in budget 2024? Also, the case mix index, or CMI, can change rapidly in a facility, but is only updated on an annual basis. This can underfund operators, Madam Chair, and I just want to know if the minister is creating a more timely funding response to these changes in resident acuity, and where this will be tracked in the business plans. And I'd like to move over quickly to home care. That's in the estimates 2.3. So there are certainly some fundamental flaws in our home care system. One key issue is the lack of qualified available staff. Staff are paid low wages and thus often do not have proper skills, training, or education. Stable and reliable staff are so important, as those needing support are vulnerable. What's the government doing to improve this situation, and where is that reflected in the budget? Another key issue that I hear of regularly is the allocation of hours for home care. I've heard many stories of not receiving adequate support to properly maintain vulnerable citizens in their homes. This situation puts the citizen at risk, which may lead to hospitalization and eventually moving to continuing care. How is the minister addressing this issue to ensure that clients, our patients, are provided with the amount of care that the ministry is paying for? And I just want to go back to 1.4, which is concerning the Health Advocates Office. So this advocate reports directly to the minister. And back in 2019, the Office of the Seniors Advocate was closed by the UCP, and the minister at the time said that seniors would be supported by the health advocate. But, and the closure of the Seniors Advocate Office meant there was no longer duplication of services. Yet 2/3 of the work of the Seniors Advocate staff was related to financial and social service issues. In the last report of the Health Advocate, it indicates that these issues are out of scope of the Health Advocate. Would the minister please explain how Budget 2024 plans to address this discrepancy to ensure that seniors have access to an advocate for these issues? Also, the latest report of the Health Advocate is 21-22. Can the minister explain how she is addressing issues highlighted by the advocate in the absence of reporting, and where in Budget 2024 we can see the results of changes called for by the advocate? Annual reports are due in June of the last report should have been, submitted and by June of 2023, and we have nothing in terms of a health advocate report. So I'm hoping that the minister can explain how she's getting this information, how come the public isn't receiving information about the health advocate's work, what exactly is she saying? Is she meeting with the advocate on a regular basis to deal with these important issues? I think that Albertans would like to know about those key issues.
Honourable member, we'll move over to the minister for her response.
Well, thank you for the questions, and continuing care supports and having the right workforce is extremely important. So it is the reason why, as part of that $1 billion, we've established a continuing care workforce group to make recommendations on supporting staff, including staff, professional associations, et cetera. These are included in that workforce group. So they have a report to myself coming this spring, and so I'm looking forward to getting that report and their recommendations. Obviously, given all of the other previous engagements and that we've acted on those previous engagements, I know that they're committed to making sure that we make continuous improvements within our continuing care overall funding, as well as workforce strategies, et cetera. We've increased the wages of healthcare aides by $2 per hour. So that covers not just continuing care workers, but also home care workers, because we do recognize that they provide a valuable service, and it is hard work, and they should be fairly compensated. So again, having that increase of wages, that's going to be ongoing, so that's included within our commitments and our dollars. We've got bursaries to support people to become healthcare aides. So again, making sure that we are able to fund those that are taking post-secondary to get their credentials. We want to make that more easily accessible across the province. It's why we've increased spaces across the province as well. We've got money to Indigenous colleges, to 2 Indigenous colleges to develop healthcare aid Indigenous context training. We want to make sure, and that's something that I've heard from Indigenous communities, that they want to have their own trained workforce, and so we're enabling that to happen. We're providing funding to care centers specifically to support mental health of staff, because we know it's very taxing to work with individuals. It's emotionally hard at times. As I said myself, as a rehab practitioner, I know how you bring that home with you. You internalize the work that you do with individuals, so we want to make sure that they're supported. And we've increased hours of care in long-term care by 0.25 this year, and we'll continue to increase this year after year. I know a question was asked to talk about the new legislation. So in the new legislation, as I said earlier, this was outdated legislation. There were several acts, I believe 4 in total, that now have been consolidated into one functional act. This was after extensive stakeholder feedback. and engagement with continuing care home providers, with residents, with families, with regulatory colleges, with union representatives and post-secondary institutions. So the new regulations, as I said, have been compiled with that extensive feedback from those individuals. And in that, there is, the intent of the staffing within the new regulation is to establish requirements for the operator to develop a staffing plan that meets the unique needs of the residents while maintaining specified clinical staff requirements. Example, 24/7 registered nursing in type A long-term care, it used to be called long-term care, continuing care homes. So this approach maintains requirements to enable accountability while increasing the flexibility from the current state overall and in key areas. I can also state that the type A long-term care operators in Alberta are actually funded to provide an average of 3.62 worked care hours per resident, which is significantly improved upon from what was existing previously in the 1.9 hours in the nursing home operations regulation. That was outdated and that was part of the regulation that existed since 1985. And so just to answer your question, it is actually 3.62 that Albertans are funded for. We've seen an increase in 22-23 of the Office of the Alberta Health Advocate. They've witnessed an increase in the number of files that they are able to manage to 1,632, and the number of issues managed now are 2,296. So in the last year, as I said, they've now increased their capacity.
Thank you so much, Minister. We'll head back over to the government side for their questions.
Thank you, Madam Chair. Through you to the Minister. Minister, if it's okay to go back and forth?
Sure.
Thank you, Minister. First of all, I would like to thank you and your team for your hard work for Albertans. And I have a couple more questions around access to care beds. Certainly, facility space is very important, as we have spent some time discussing earlier. Available qualified staff is another major factor in how much capacity we have within the continuing care system. And I see on page 78 of the fiscal plan looking at staffing, especially in continuing care. Can the minister please tell us how much is being spent on the continuing care capacity plan, and can the minister supply us with general update on how the plan is progressing? Thank you, Mr.
I'm happy to do that. Thank you for the questions. So AHS will spend an additional $50 million in 24-25, which is $245 million over 3 years to support the continuing care capacity plan. So an additional 750 beds and spaces are forecasted to open in 23-24. And in total, that'll be 2,390 bed spaces over the next 3 years. So 510 net new spaces expected to open in 24-25, 950 net new spaces expected to open in 25-26, and 930 new net spaces are expected to open in 26-27. Again, we know that we have an aging population, and there's more to be done, and so we'll continue to work to make sure that we add capacity across the system over the years that as our population continues to grow and to age.
Thank you, Minister, for answering. And moving along to line item 2 in the operating expenses of the estimates section, page 110 for Alberta Health Services, and the line is 2.3 and is home care. This line has a funding increase of about 27 million over last year's budget. And I have always felt that people who are able to get back to their homes to recover with their family and loved ones has always had a positive effect on patients. And what I would like to know is, what types of services does the home care line fund within Alberta Health Services, and what, if any, benefits to this additional funding bring to patient care? Thank you, Minister.
Thank you for the question, because it really is about health and personal care services that support Albertans so that they can age in place and remain independent. I know myself, as I journeyed with my in-laws, they really wanted to be as independent as possible, right to their final moments. And so sometimes this isn't possible, but what does make it possible is to have excellent home care. And so it can be short-term, it can be long-term. Some of the things that home care handles is case management and professional care, personal care. They can provide home and community support services. They can provide self-managed care or client-directed home care, caregiver support and respite. They can provide adult day programs. They can provide restorative, rehabilitative type care, and they can also do palliative and end-of-life care. So in the next fiscal year, Alberta home care clients will benefit from enhanced access to palliative and end-of-life care at home, increased availability and access to client-directed home care programs in rural Alberta, and increased support for caregivers. We really want to give the residents, Albertans, the choice so that they can choose what is best for them and make sure that their needs are being met. And so that is something that you will see within the home care is more choice and availability for patients across Alberta.
Thank you, Minister, for answering. And through you, Madam Chair, and my question again is on continuing with home-based care initiatives. And I appreciate that this is an important option for Albertans to remain independent and in their own homes. That feeling of independence, of being comfortable in your own surrounding, is a powerful benefit to home-based care. And on page 78 of the fiscal plan, we see that 70 million will support home and community care initiatives. And can the minister please provide details on how these initiatives will support patients' care needs?
I'm happy to. And again, the $70 million is new incremental funding, which will be used to scale and spread continuing care transformation investments in home care and community care right across the province. So expanding home and community care capacity, investing in enhanced palliative and end-of-life services for home care patients, enhancing caregiver supports, including building awareness of caregiver roles, increasing capacity for expanding caregiver programming availability, and training caregivers. We know that well-trained caregivers and consistency with caregivers has a positive impact on individuals in these situations, so we want to make sure that we have that funding. Additionally, we're also adding new incremental funding of $69.4 million. It'll be used for accelerating continuing care transformation investments in continuing care homes, including enhancing continuing care workforce education, training, development, and engagement, increasing continuing care workforce mental health supports, improving rural continuing care workforce capacity, enhancing compliance and monitoring capacity, and enhancing quality of life best practices and initiatives. So all of that we are funding through the Aging with Dignity bilateral agreement that we have with the government. It's a total investment of $139.4 million of new incremental funding. That's in addition to all of the great things that are already going on in this area. But we know that we hear more and more from people that they want to stay at home as long as possible, and home care allows them. And sometimes it's individuals who've gone to hospital and need that extra little bit of support after they get out of the hospital that is also provided. So there's a variety of options, and we look to expand that as we move forward.
Thank you, Minister. Madam Chair, through you to Minister. And my next line of question is on drugs and supplemental health benefits. Drugs and supplemental health benefits are their own huge topic, one we would spend more time discussing than we have available today. And drug benefit coverage is something I hear about from my constituents of Calgary East. It is very much affects the individual's health and daily lives. And on page 79 of the fiscal plan, over $2 billion have been included for drugs and supplemental health benefit programs. And this is an increase of 111 million from last year, with 883 million budgeted for the seniors drug program in 2024-2025, serving 700,000 Alberta seniors. Can the minister please indicate how this large investment will help expand coverage to Albertans and how these increases will modernize drug coverage and care? Thank you, Minister.
Thank you for the question. And yes, we do have a very extensive program for drugs and supplemental health benefit programs. We do supply fund over 5,000 drugs here in Alberta. More complex and expensive pharmaceuticals are coming online all the time within the Canadian market. And pharmaceutical manufacturers have begun focusing on specialized medicines and treatments for rare diseases. And it's really exciting to see the innovations and the new things that are coming that really target certain illnesses and certain cancers, et cetera. So, obviously we have to invest, and so these are wise investments. These pharmaceuticals come with significant budget impacts to government. So Alberta's government aims to provide Albertans with access to necessary pharmaceuticals based on the best available evidence to support their use. And there is a process that happens, and the way it works is the department is continually working to lower the cost of pharmaceuticals through our partnership with the Pan-Canadian Pharmaceutical Alliance and other formulary management tools without impacting patient access and care. So we know that there's a process that happens at the federal level, and then we work with the federal government to really refine and try and get those costs at a lower cost for Albertans. So increases to the drug and supplemental health benefit program budget ensure that Alberta's government can continue to offer pharmaceuticals to Albertans and keep up to date with changing therapeutic spaces.
Thank you so much, Minister. We'll move back over to the official opposition for their time.
Thank you, and through you, I have more questions for the minister, and they're on the same topic, drugs and supplemental health benefits. In the estimates document, I'm referencing line 4.2 on outpatient drugs, and specifically that this line item has decreased over this year, and I'm wondering how this will happen given population increases. Are there drugs that are being delisted, or perhaps better prices are coming, have been negotiated, or more generics are becoming available? I'm just trying to understand that. Within this line item, I believe is the opioid agonist therapy gap program funding. Is this program at risk of being discontinued? One of my concerns about the decrease in this budget item. This OAT gap coverage program only covers some of the opioid agonists, buprenorphine and methadone, and it covers them for 120 days. This means that people who have not benefited from these cannot go on to other slow-release drugs that are recognized in the Canadian Opioid Use Disorder Guideline as another form of opioid agonist treatment. And so I'm wondering why this gap coverage program is not adhering to other opioid use disorder guidelines. And then considering that this is a very low expense to Alberta Health and can have very significant life-saving and cost-saving potential, would the minister consider extending the period of universal gap coverage perhaps to a year, at least recognizing that in that beginning time when people with suffering from addictions are not the best at completing paperwork and forms, maybe a little bit longer time would be helpful. My next question also relates to the drug programs. The seniors, line 4.3, which is seniors, drug, dental, and optical and supplementary health benefits. This line item is not going up in keeping with population, and yet the older age groups are increasing at a faster rate in Alberta than across Canada. Alberta's population age from 60 to age 69 has increased by 4.2% over the past year, which is nearly double the increase in Canada. And I'm wondering how we're going to keep up with the cost of this program. Line item 4.4 is non-group drug and supplemental health benefits. This figure seems to reflect an increase similar to inflation and cost of below inflation and cost of living. What is responsible for this change? I note that non-group coverage for clinical psychological services are up to $60 per visit in this program, to a maximum of $300 per family each benefit year. And this is for treatment of mental and emotional illness by registered chartered psychologists. Yet the Psychologists Association of Alberta recommended fee schedule is $220 per hour. So the $60 per hour really doesn't help much for people that don't have access to service. And I'm wondering if there is a plan to bring this in line with the actual cost of the service. As well, Alberta is opting out of the federal government's plan to cover diabetes medications and birth control.
Thank you, Mr. Chair. The point of order is under Standing Order 23B. The member speaks to matters other than the question under discussion, and Mr. Chair, the committee has convened for the purpose of considering the ministry's 2024 budget, including estimates, fiscal plan, and business plan. The matter that has been raised by the member is not within the boundaries of the said topic. The pharmacare program by the federal government mentioned by the member is not related to the Ministries of Health's 2024 budget, fiscal plan, or business plan. And Mr. Chair, under Standing Order 23B, that the matter that cannot be raised in today's consideration of the Ministries of Estimates. Thank you, Mr. Chair.
Yes. I'll just look at the colleague.
Thank you, Deputy Chair. I do not believe this is a point of order. 4.4 talks about non-group drug and supplemental health benefits. Whether or not a drug is adequately covered under that program, or whether it would fall under pharmacare, is absolutely a matter of debate. This is not a point of order.
I have to agree, this is not a point of order.
So I guess, so I'm really wondering if we're not going into that program, there was potential for saving in this line item. And I'm wondering about whether we will be making equivalent services available to Albertans who have this coverage, but yet Alberta will not, if Alberta is not going to be going with this federal plan. And in my last few minutes here, the child health benefit, line 4.6 in the estimates document. This program allows low-income families to apply to get eyeglasses, prescription drugs, and dental care, etc. But the increase is not keeping up with population growth and inflation. How will this be adequate?
Yeah, sure. You have 5 minutes, Minister.
Thank you so much for the great questions. And when we look at the outpatient drugs that were mentioned earlier, yes, there is a decrease, and I'm happy to speak to this. The patient for the purchase of outpatient cancer therapy and specialized high-cost drugs, HIV, cystic fibrosis, organ transplant, rare diseases, and other specialized needs that are administered by Alberta Health Services. These are included in this. The outpatient drug grant is made up of two components. It's $333.3 million for the outpatient cancer therapy drug program, which provides cancer drugs to eligible Albertans who are receiving cancer treatment outside of hospital. And there's $146.7 million for the specialized high cost drug program provided specialized drugs at no cost to Albertans through the Rare Disease Drug Program, Short-Term Exceptional Drug Therapy Program, and Specialized High-Cost Drug Programs. There's a $13.4 million decrease attributed to $17.8 million decrease in outpatient cancer drugs due to lower anticipated requirements. But there is also a $4.3 million increase to outpatient specialized high-cost drugs for the anticipated volume growth as more patients are provided treatment, as well as new drugs expected to be added to the program. So while there was 17.8 decrease, but there was a 4.3 million increase. So they offset each other, and that's the difference in those two numbers. On the opioid agonist, it's always hard to say that particular, program, that really falls under the purview of mental health and addictions, and I know that Minister Williams would be very happy to have conversations with you on this particular, on the effectiveness, on the prolonged use, et cetera, of this particular therapy, and I'm sure he would be happy to provide those answers to you. For that particular piece. Seniors, we are providing just let me grab the right sheet here. There it is. Lots of paper. Just so many great things happening in health, that's why. So low-income seniors have access to essential dental and optical benefits through the Dental and Optical Assistance for Seniors programs. We provide eligible low-income Albertans over the age of 65 access to essential dental and optical benefits to support their healthcare needs. So the cost is over $143.1 million in 22-23, and it's forecast at $148.3 million in 23-24. Seniors Dental, Optical, and Supplemental Health Benefits Program is shown on page 110, which we all know that. So we're really looking, eligible seniors are provided up to a maximum of $5,000 of dental coverage every 5 years for select dental services and procedures that maintain a reasonable level of dental health, and financial assistance for the purchase of prescriptions, eyeglasses up to a maximum of $230 every 3 years. And this is negotiated on a regular basis. We are always looking to improve these services, and so I'm confident that we will continue to have those conversations and make sure that we're providing the supports that low-income seniors need. And let me just see if there's anything else. I think I've covered the rest of that particular piece. On the non-group, which is another program that you were referring to. Non-group and supplemental health benefits cost approximately $199.9 million in 22-23. That's actually $198.5 in 23-24, and we see that number going up to $214,325 in 24-25. So what is covered here is ensuring all Albertans have access to supplementary health benefits programs that provides coverage for a variety of health-related services, including prescription drugs. Non-group coverage is designed to provide access to supplementary health benefit plans, even if an individual has pre-existing conditions. Subsidized rates are available to those who qualify based on information reported from their income taxes. And I know that there are many Albertans that are making use of this. In fact, the number has grown from 73,398 in 22-23. We anticipate it will be well over 75,637 in 24-25. So we're seeing more people make use of these good programs that we have available. The Alberta Health Benefit Program provides eligible children.
Thank you, Minister. We'll move back over to the government side for the final block.
Thank you, Chair, and thank you, Minister, through the Chair, and your staff and your team for being present today to answer questions. I'll jump right in. I'd like to ask some things around emergency medical services. It's something that frequently comes up for me with constituents and folks that I chat with around the province. Many folks, whether they're elderly or have complex medical needs or have family members who need emergency medical services, they're worried that an ambulance won't reach them in a timely fashion. This, for me in rural Alberta, is something I hear a significant concern around. And some are concerned that an ambulance won't be available at all, and a number of communities, thankfully, we have great medical first responders in a lot of our rural communities. But inevitably, our province has a significant rural population, and folks believe that urban and rural Albertans should have appropriate access to life-saving services like EMS. I looked at the performance metrics for EMS for 2022 and 2023 that has response times at 17 minutes for metro and urban communities, 18.9 minutes for communities above 3,000 residents, 33.9 for rural communities, and 61.8 minutes for remote communities. I was hoping the minister could explain what improvements are being considered to increase these metrics and provide Albertans with a better EMS service.
I know we've spoken of this earlier, but I'm happy to reiterate the fact that, yes, we're seeing improvements, but they're not where they need to be. And so we're going to keep working at it. We've got the APEC standing committee that is continually reviewing and recommending how we can implement the recommendations that were provided to us and make those significant improvements. We need to reduce our EMS response times. We need to get better on the offload times. We need to make sure that inter-facility transfers happen and that we utilize the best support at the right time for those procedures.
I apologize for the interruption, but I must advise the committee that the time allotted for the portion of consideration of the ministry's estimates has concluded. I'd like to remind committee members that we're scheduled to meet this afternoon at 3:30 p.m. to continue our consideration of the estimates of the Ministry of Health. Thank you, everyone. The meeting's adjourned.